There are 32 to 46 million people living in the United States without health insurance. Of these 32 to 46 million people, 30% of these are 19 to 24-year-olds, your average college student. The current health care bill was signed into law on Tuesday and is now up for reconciliation in the Senate. Many of us have heard many true and untrue things about this current health care bill, and I'm sure many of you are wondering, how does this bill directly affect you? Well, to understand that, we must first understand three important things: pre-existing conditions, subsidies and Medicaid, and another small provision in the bill. The current health care reform bill will provide young adults better access to more affordable health care. As of right now, pre-existing conditions affects anyone in the United States that's not on a large group plan. Most of these pre-existing conditions are for children and young adults. Sometimes these children and young adults can even be denied insurance due to their particular pre-existing condition. Columnists Richard Wolff and Allison Young of the USA Today point out that later this year, insurance companies will no longer be able to deny children insurance based on pre-existing conditions or refuse to pay for medical costs due to their pre-existing conditions as part of the new health care reform bill. For adults, insurance companies will no longer be able to deny you insurance due to pre-existing conditions starting in 2014. However, it's unsure when in 2014 this will actually take effect. For young adults, this is especially important because many of us are having to get off our parents' health insurance and get our own. This health insurance can be extremely pricey, and you can even be denied due to pre-existing conditions. The new health care bill provides several more affordable ways to find health insurance in subsidies and Medicaid. As of right now, most young adults without children do not qualify for Medicaid. Therefore, if you can't afford private insurance, you must do without. Emily Beaver at Youth Media International points out that by 2014, you'll be able to qualify for Medicaid or subsidies to buy insurance at the new state insurance exchanges. These insurance exchanges will create more competition between insurance companies, which will lead to a better priced option. Whether or not you qualify for subsidies or get state-based Medicaid will depend on your income and your marital status. For those young adults who are still dependents of their parents, paying for insurance can be a struggle because there are not very many affordable options for those of us who are still in college. As of right now, once you reach the ages of 22 or 24, depending on your insurance company, you are forced to get off your parents' plan and find your own insurance. Richard Wolff and Allison Young at the USA Today point out that in the new health care reform bill, there is a provision that would allow young adult dependents to stay on their parents' insurance until they are 26. It is unsure, as of right now, when this will take effect. Perhaps the biggest benefit to young adults is the combination of all these provisions that would create more affordable priced healthcare options. Emily Beaver at Youth Media International says that the new healthcare reform will let many young adults start their own businesses earlier because they are no longer worrying about the high cost of health insurance. Now, to answer the question of how does this bill benefit you, well, that will depend on your particular situation. However, the healthcare reform bill will benefit young adults as a whole by creating more affordably priced options. If you're in the group of young adults going off to graduate school, you will now be able to stay on your parents' insurance until you're 26 or until you graduate. If you're in the group of young adults who have already graduated and are wanting to start a small business, now you no longer have to worry about finding an affordably priced insurance plan. If you're in the group of young adults who have no longer been able to afford your health insurance, you will now be able to qualify for subsidies or Medicaid. And if you're in the group of young adults who are being forced to get off your parents' plan but have a pre-existing condition such as asthma or diabetes, you will no longer be able to be denied and you will be able to find affordably priced options.